Welcome back to Senior Health Star, the channel dedicated to helping you live your golden years with vitality, dignity, and joy. I'm your host, Dr. Emily Carter, and today we're diving into a topic that could literally save your life, or the life of someone you love. It's called 7 personal hygiene mistakes elderly make that doctors notice immediately. These aren't just small oversights. They're silent warning signs that could point to serious health issues. And trust me, doctors spot these red flags the moment you walk into their office. Did you know that simple hygiene habits, or the lack of them, can reveal dangerous conditions developing in your body? These mistakes are so common among seniors that most don't even realize they're making them. But here's the good news. By catching these issues early and making small changes, you can protect your health, maintain your independence, and add years to your life. Today, I'm going to share real stories of seniors just like you, people who thought they were doing everything right until their doctors noticed something alarming. We'll uncover the 7 personal hygiene mistakes elderly make that doctors notice immediately, and I'll give you practical, easy-to-follow solutions to fix them starting today. Plus, stick around until the end for a bonus tip that could be the key to catching health problems before they spiral out of control. If you're over 60 or care about someone who is, this video is for you. Before we dive in, please hit that subscribe button and ring the notification bell so you never miss our life-saving health tips. And if you find this video helpful, share it with a loved one. It could make all the difference. Now, let's get started with a story that hit close to home for me. Meet George, a 72-year-old retired mechanic who loved spending time with his grandkids. George was active, ate reasonably well, and thought his daily routine was keeping him healthy. But during a routine checkup, his doctor noticed something alarming. George's gums were swollen, and his breath had an unusual odor. These weren't just cosmetic issues. They were signs of a serious problem. Mistake number 1, neglecting oral hygiene. When was the last time you really looked at your toothbrush? Is it frayed or worn out? Are you brushing thoroughly twice a day? And here's the big question. Did you know that poor dental care isn't just about bad breath or tooth loss? It's directly linked to heart disease, stroke, and even dementia. Geriatric specialists at Harvard Medical School have proven that bacteria from untreated gum disease can enter your bloodstream, causing life-threatening heart conditions. In George's case, his doctor discovered that his swollen gums were a sign of untreated gingivitis, which had begun to affect his heart valves. If he hadn't acted quickly, the damage could have been irreversible. George's story isn't unique. I recently spoke with a viewer, Linda, who shared a similar experience. Linda, a 68-year-old from Texas, ignored her bleeding gums for months, thinking it was just a normal part of aging. But her cardiologist found inflammation in her heart, caused by oral bacteria. She told me, "I had no idea my mouth could affect my heart. If my doctor hadn't caught it, I might not be here today." So what can you do right now? First, check your toothbrush. If it's over 3 months old or showing wear, replace it immediately. Studies from the University of Pennsylvania Dental School show that electric toothbrushes remove 62% more plaque than manual ones. So consider making the switch. Brush for a full 2 minutes twice a day. Set a timer if you need to. Floss every night, no exceptions, and never skip your dental checkups, even if you have dentures. Have you noticed bleeding gums or swelling when you brush? These aren't normal signs of aging. They're your body's warning signals. Don't ignore them for another day. And if you're thinking, "I don't have time for all this," let me tell you, a few minutes a day now can save you from months of medical treatments later. If you've ever dealt with gum problems or have a dental tip to share, drop it in the comments below. Your story could help someone else in our Senior Health Star community. Let's keep the conversation going. Clara, a 70-year-old retired librarian, was the picture of independence. She lived alone, cooked her own meals, and loved her weekly book club. But Clara had a habit she didn't think twice about. She only bathed once or twice a week. "I'm not that active," she thought. "Why bother?" But during a visit to her doctor, a subtle discoloration on her skin raised a red flag. Mistake number 2: infrequent bathing and skincare. Your skin is your body's largest organ, and changes in its condition can reveal serious internal problems before other symptoms show up. Dermatologists at the Mayo Clinic warn that reduced bathing in seniors can mask early signs of diabetes, liver problems, and cardiac issues. In fact, their studies show that nearly 40% of undiagnosed conditions in elderly patients could have been caught earlier through proper skin observation. For Clara, her infrequent bathing hid a critical symptom: early-stage kidney disease. The discoloration her doctor noticed wasn't caused by poor hygiene itself. It was a sign her body was struggling internally. Clara later told me, "I thought skipping baths was saving my skin from drying out. I had no idea it was hiding something so serious." Clara's story reminds me of a patient I worked with years ago, Mr. Thompson, a 75-year-old veteran. He reduced his bathing to once a week during winter, thinking it was enough. But his doctor noticed unusual dryness and itching, which led to a diagnosis of thyroid dysfunction. A simple change in his routine could have caught it sooner. Here's what you can do starting today. Bathe at least 3 times a week, even if you're not active. Use a mild, fragrance-free soap to protect your skin's natural oils. After bathing, apply moisturizer while your skin is still damp to lock in hydration. When was the last time you really looked at your skin? Are you noticing anything unusual? Don't wait. Address these signs today. Your skin is trying to tell you something, and it's up to you to listen. If this tip resonates with you, please hit that subscribe button and join our Senior Health Star community. We're here to empower you with the knowledge to stay healthy and independent. Let's move on to mistake number 3. Evelyn, a 78-year-old grandmother, loved tending to her garden. It was her sanctuary. But she hadn't paid much attention to her nails, which had become thick and discolored. She thought it was just a natural part of aging and hid them with gloves. But during a routine visit to her podiatrist, her nails told a different story. Mistake number 3: ignoring nail care. Your nails are a window into your overall health, and doctors check them immediately when evaluating elderly patients. According to the American Academy of Dermatology, nail changes can indicate over 20 different systemic diseases, from anemia to thyroid issues to heart disease. Their research shows that in patients over 65, nail abnormalities led to the diagnosis of previously undetected conditions in nearly 30% of cases. For Evelyn, her podiatrist diagnosed a fungal infection that had gone untreated for too long, revealing a suppressed immune system. Further testing uncovered an autoimmune condition that needed immediate attention. Evelyn told me, "I thought my nails were just getting old like me. I wish I'd known they were trying to warn me." Evelyn's story isn't uncommon. I recently heard from a viewer, Tom, a 70-year-old from Ohio, who noticed his nails becoming brittle and splitting. He ignored it until his doctor linked it to a vitamin deficiency that was affecting his heart health. A simple nail inspection could have caught it sooner. Here's what you need to do. Trim your nails regularly, straight across with slightly rounded edges to prevent ingrown nails. Keep them clean and dry. Wear breathable footwear and change your socks daily. And never ignore changes in nail color, texture, or thickness. These aren't cosmetic issues. They're potential warning signals. Look at your nails right now. Are they brittle, discolored, or thickened? These changes aren't inevitable. They're your body's way of asking for help. Act on them today, and you could catch a problem before it becomes serious. Have you noticed changes in your nails? Share your experience or a nail care tip in the comments below. Let's support each other in our Senior Health Star community. Now, let's talk about a mistake that's more common and more shocking than you might think. Henry, a 74-year-old retired teacher, was the life of every family gathering. But behind his warm smile, he was hiding a secret: occasional bladder leakage. Too embarrassed to talk about it, he used paper towels and changed his clothes frequently, thinking he was managing. But when painful sores appeared, his doctor uncovered something far more serious. Mistake number 4, improper incontinence management. This is perhaps the most shocking mistake because it's so common and so often hidden. Over 50% of seniors deal with some form of incontinence, but many hide it instead of seeking help. Urologists at Johns Hopkins Medicine report that untreated incontinence can lead to skin infections, falls, social isolation, and even mask serious conditions like bladder or prostate cancer. For Henry, his makeshift solutions led to skin breakdown, which revealed an advanced prostate condition that could have been treated months earlier. He later told me, "My pride almost cost me everything. I wish I'd talked to my doctor the moment I noticed a problem." Henry's story hit home for me because I've seen it so many times. Just last month, a viewer, Margaret, shared how she avoided social events due to leakage fears. Her doctor's intervention not only improved her quality of life, but also caught an early bladder issue. Incontinence isn't just a nuisance, it's a health signal. If you're experiencing incontinence, here's what to do. First, talk to your doctor. They see this every day, and there's no need for embarrassment. Use absorbent products designed for incontinence, not paper towels or other makeshift solutions. Change promptly when wet, and follow a proper cleansing routine to prevent skin issues. Most importantly, know that incontinence is not a normal part of aging. It's often a symptom that needs attention. Are you planning your day around bathroom access or using makeshift solutions? Don't let embarrassment stop you from seeking help. Your health and your freedom depend on it. If this resonates with you, please subscribe to Senior Health Star and share this video with a loved one. It could be a game changer. Let's move on to mistake number 5, one that's surprisingly dangerous. Prided herself on her meticulous habits. Every morning, she cleaned her ears with cotton swabs, thinking she was keeping them spotless. But one day, a sharp pain in her ear sent her to the doctor, where she learned she'd made a costly mistake. Mistake number 5, ear hygiene errors. Are you using cotton swabs to clean deep inside your ears? If so, you're making a dangerous mistake that many seniors don't realize. Otolaryngologists warn that improper ear cleaning can damage your hearing and miss signs of serious infections. Their research shows that improper ear cleaning causes nearly 40% of ear canal injuries in patients over 65. For Susan, her cotton swab habit punctured her eardrum, leading to a severe infection that caused permanent hearing loss. She told me, "I'd always cleaned my ears this way. No one told me it was dangerous." Susan's story reminds me of a patient, Mr. Lee, who used hairpins to clean his ears, a habit that led to an infection requiring surgery. Proper ear care could have prevented it. Here's the golden rule: never insert anything smaller than your elbow into your ear canal. Clean only the outer ear with a warm, damp washcloth. If you suspect excess wax, use eardrops designed to soften it, following the instructions carefully. And if you notice pain, discharge, or hearing changes, see a doctor immediately. Are your ears itchy, blocked, or showing hearing changes? Don't try to fix it yourself. Your hearing is too precious to risk. If you've learned something new, please subscribe to Senior Health Star and let us know in the comments how you care for your ears. Let's keep moving to mistake number 6. Apart from this story, Walter, a 77-year-old retired carpenter, loved his daily walks around the neighborhood. But he rarely inspected his feet, assuming their dryness and small cuts were just signs of aging. During a routine exam, his doctor noticed something that changed everything. Mistake number 6. Poor foot hygiene. Your feet are a map of your health, revealing clues about your circulatory and nervous systems. Podiatrists at the American Podiatric Medical Association state that foot hygiene issues often show the first signs of diabetes, neuropathy, and vascular disease. Their studies show that proper foot care could prevent up to 85% of diabetes-related amputations. For Walter, his doctor's inspection caught early-stage diabetes, allowing him to make lifestyle changes before it progressed. He told me, "I never thought my feet could tell my doctor so much. I'm so grateful they did." Walter's story echoes one from a viewer, Diane, who ignored foot numbness until her doctor linked it to poor circulation. Regular foot care turned her health around. Starting today, wash and dry your feet daily, especially between the toes where fungus can grow. Inspect them regularly for cuts, sores, or changes in color or temperature. Wear clean, dry socks made of natural fibers and apply moisturizer to dry areas, but not between the toes. If you notice pain, numbness, or wounds that don't heal, see a doctor right away. Are your feet dry, cracked, or numb? These aren't just annoyances. They could be early warnings of serious conditions. Take action today. If this tip could help someone you know, please share this video and subscribe to Senior Health Star. We're almost at our final mistake, but it's a big one. Joan, a 66-year-old retired florist, was diligent about taking her medications, but recently she noticed an unusual body odor, even after showering. Her family teased her about hygiene, but her doctor saw something far more serious. Mistake number 7. Medication-related hygiene issues. If you're taking multiple medications, have you noticed changes in body odor, sweating, or mouth dryness? Pharmacologists at the American Geriatric Society warn that certain medications can cause hygiene changes that signal dangerous side effects. Their research shows that nearly 40% of adverse drug reactions in seniors first appear as hygiene changes. For Joan, her body odor was a sign of medication toxicity affecting her liver. She told me, "I was so embarrassed. But it wasn't about cleanliness. It was my body crying for help." Joan's story reminds me of a patient, Mr. Patel, who experienced excessive sweating from a new medication. His doctor caught a drug interaction just in time. Here's what you can do. Keep a simple journal to track hygiene changes after starting new medications. Note body odor, sweating, or mouth dryness. Stay hydrated unless your doctor advises otherwise. Report unusual changes to your doctor immediately. And never adjust dosages on your own. Have you noticed unusual odors or sweating? Don't dismiss them as aging. They could be warning you of serious medication effects. If this information could help you or a loved one, please subscribe to Senior Health Star and share this video. Now, as promised, here's your bonus tip. Here's the bonus tip that ties it all together. Schedule regular checkups, even if you feel fine. Your doctor can spot subtle hygiene changes that you might miss. A simple visit could catch a problem before it becomes life-threatening. By addressing these 7 mistakes: oral hygiene, bathing, nail care, incontinence, ear hygiene, foot care, and medication issues, you're not just improving your appearance, you're safeguarding your health and independence. And with regular checkups, you're giving yourself the best chance to thrive in your golden years. Thank you for watching. 7 personal hygiene mistakes elderly make that doctors notice immediately. If you found this valuable, please hit the like button, subscribe, and ring the notification bell to join our Senior Health Star community. Have you or a loved one experienced any of these hygiene issues? Share your story in the comments below. Your experience could inspire someone else. And don't forget to share this video with anyone over 60. It could save a life. Until next time, stay healthy, stay empowered, and keep shining with Senior Health Star. See you in the next video.